Hey again, this is a series of lectures for the Applied Anatomy for the Medical Professional. We're going to go through two lectures. The first today is going to be on the urinary system, the anatomy and pathologies, pretty much just an overview of what the urinary system can do. So the topics we're going to talk about: the gross anatomy, just a little bit about an overview of the function, and then I'm going to throw out some pathology, something to look for if you see these symptoms. First question: the kidneys have a total of 7 functions. What is not a function of the kidneys? Is it acid-base balance, blood pressure control, oxygenation, or calcium homeostasis? And I'll explain what a wet bed means in just a second. So the right answer is it doesn't oxygenate the blood, but it does so much more. It allows for getting normal acid-base balance, so you can keep your pH of your blood at normal 7.43. It takes care of excess water removal. Erythropoiesis is the making or the stimulation of making more red blood cells in the bone marrow. It, of course, gets rid of toxins, water-soluble toxins, and the GI tract gets rid of the non-water soluble toxins. It manages your blood pressure, and it helps with your electrolyte balance to keep sodium and potassium in the right amount, and of course, vitamin D activation. And together, all of those things that it does makes up the acronym a wet bed. There's the D, vitamin D. So all your red blood cells are going through the kidneys, and the kidneys are great because they're monitoring both how well your oxygen delivery system is working. It also monitors your oxygen carrying capacity. So it monitors if you're anemic or if you're hypoxic. And in response, it releases the hormone erythropoietin, or EPO for short. And that EPO stimulates the bone marrow to produce more red blood cells. So erythro means red blood cells, and poietin means maker. So the other thing, as a secondary endocrine organ, it manages calcium. So calcitonin also is produced by the kidneys along with the thyroid. So it's your backup system for your thyroid gland. And the erythropoietin stimulates red blood cell production from bone marrow. And then the renin increases blood pressure. So three hormones secreted by the kidneys. Okay, let's go for a pathology case, a case scenario. You have a 55-year-old man. He's got a new onset of hypertension, 150/100. He started on some pretty good antihypertensive medications, and he's very diligent about taking his medications. And a 3-month follow-up, his blood pressure is even higher at 180/120. So he's diagnosed as having accelerated hypertension, and he's scheduled for a renal arteriogram. So they're going to look at his kidneys to look at his arteries supplying his kidneys. And with an arteriogram, dye is injected into the vascular supply, like in the brachial vein. And then the dye, as it's excreted through the kidneys, you can see the vascular supply going to the kidneys. So if that systemic blood pressure, what happens to systemic blood pressure if renal blood flow is reduced? A, does the blood pressure rise? B, does the blood pressure lower, or does it have no effect, staying the same? So the answer is the blood pressure rises. So what's happening is as the blood flow gets reduced to the kidney, I guess, misinterprets that as the whole body is not getting enough blood flow. And so renin is released, it increases the blood pressure. So in effect, the blood pressure is being increased inappropriately. And this is the case that happens in renal artery stenosis, or narrowing of the renal artery. The treatment for this is a stent placement. Here, this is a stent coming in, opening it up, and that increases the renal blood flow. So the hormone renin is right here. It's picking up blood flow actually to each individual glomeruli. And this is showing some more microanatomy of the kidneys, the first part of the nephron, where the afferent, or the artery that's going to the glomerular capsule, or the Bowman's capsule, is picking up how well that blood is coming to the kidneys. And renin is released if it's perceived as low, and it sets off vasoconstriction in the systemic circulation. It also increases vascular volume. So let's see, massive trauma. Blood pressure is dropping, internal hemorrhage, so they're bleeding internally. So how does the body respond to make sure that oxygen still gets delivered to the vital organs in the case of massive trauma? A, kidneys produce renin, vasoconstriction of the periphery, grab some spare blood that the spleen is holding out on, and ADH from the posterior pituitary, or antidiuretic hormone from the posterior pituitary. The truth is, your body is doing all of these things in a case of severe dehydration, severe trauma, massive blood loss. All of those things are happening. All right, so let's go on to the urinary system and just go through an anatomy review. The kidneys are behind the peritoneum, so they're called retroperitoneal structures. Why does the right kidney sit lower than the left? Is it because the stomach or because of the liver? And this is a posterior view showing the kidneys. The answer, the kidneys sit lower on the right because of the liver, sorry. So the liver has this effect, and this is again a posterior view showing the thoracic and the lumbar spines from the back. All right, another question, getting some review from the last few talks about the GI tract. What is the name of the structure indicated by the blue dots? So see this structure, and I added blue dots. See this. Is it the mesentery, peritoneum, or the omentum? Answer is it's the peritoneum. So this right here, these folds of peritoneum are called mesentery. And the omentum is the apron that lays over top of all these loops of bowel, and that's not shown in here. Okay, so that's the peritoneum. The kidneys are retroperitoneal structure. Okay, next question. Ureter versus urethra. I was having the hardest time forever trying to keep track of which is which. which is the ureter and which is the urethra, because they're spelled so similarly? Answer is the urethra is the opening of the bladder. The way to remember that, I know this is kind of silly, but nothing's better than a morning pee. Ah, urethra. Ah, your relief. Okay, so let's go on to the plumbing system, the urinary system. The only difference between a male and a female as far as the urinary system plumbing is the length of the urethra. This is showing the anatomy for a female, of course. The ureters are here. And the ureter, notice the ureter is really not a very big structure. It's not that hard to clip it inadvertently when they're doing pelvic surgery. So here is the uterus. And then this, of course, is the fallopian tube. And then this is the round ligament, or one of the ligaments, the ovarian ligament, to hold the ovary from flipping around. And all of those can be cut inadvertently during pelvic surgery. And then, of course, the ureters come down into the bladder, and then the urethra comes out of the bladder and into this external urethral orifice. So the urethra in women, shown here, is relatively short. So who is more likely to get a bladder infection, the woman or the man? The answer is a woman. The bacteria have a very short path to go from the external urethra to get up into the bladder. So women are more prone, bacteria has a chance to get up into the bladder. And especially in times where people hold their urine too much. Remember my daughter, when she was little, hated to go to the bathroom, and she would hold it, and frequently was getting bladder infections. So urine in general is sterile. And if you allow the urine to sit there in the bladder for too long a period, it starts to grow. It's not likely that men get bladder infections, but if they do, you have to rule out that they're having something going on like bladder stones, or urine is sitting there for a long time, which can happen with large prostates, and also bladder cancers can increase your risk for bladder infections. So bacteria, it grows in cracks and crevices. So this is actually my depiction of the bacteria. And here's like a bladder stone. If all these cracks and crevices. So the stone gets down into the bladder, that allows for that bacteria. And then carcinoma, of course, also an irregular surface. Okay, let's do some more pathologies, throwing men against women. And this is just a cartoon I put in, how men and women see themselves. So what structure causes urinary problems in older men? Testicles, prostates, or urethras? Which structure causes urinary problems in older men? And just about 100% of men, they're going to develop prostatic hypertrophy. And many will have prostate cancer. But let's talk about the first thing, which is benign, non-malignant prostate enlargement. The prostate surrounds the urethra. So here's the seminal vesicles providing spermatic fluid, and they share this common path right here at the urethra. If this prostate gets very large, it starts to encroach on the outlet of the bladder. So a lot of times we'll get this frequent urination, and a lot of it is overflow urination because this prostate gets so big that just the pressure of the bladder pushes the urine out. So they never completely empty their bladder. The treatment of this is called a transurethral retrograde prostatectomy, and it's called a TURP, T-U-R-P for short. And this is where the surgeon, and this is under either general or spinal anesthesia, that the surgeon puts in this rigid scope into the urethra and then has fluid that's circulating. And then he takes this roto-rooter system and reams out the prostate to take out the prostate gland, or as much as it can, to open it up so the urine will flow freely. So this is a case scenario of a 70-year-old man with a very large prostate. So it's taking a long time to clean out all that prostate tissue. Then they find out that he's not waking up in the recovery room. So the solution that's being used during this prostatectomy is a glycine solution. And the reason they choose that, it's because without electrolytes, they can use cautery. So if there's any bleeding, they can cauterize vessels. But during this TURP, when they ream out the prostate, they open up vessels. And if they have too much time, they can pump this hypotonic glycine solution into the vascular system. So too much of pure water without electrolytes causes low sodium of the blood. And that in turn will cause brain swelling, coma, seizures, and potentially death. Okay, so this also causes severe anemia. Why does an extreme low serum sodium cause this severe anemia? What's it doing to the red blood cells? Is it causing hemolysis or cell shrinkage? And hopefully you can tell from this image that it's called hemolysis, where the red blood cells actually burst. So these are 3 images showing what happens if the serum sodium is too high. That's a hypertonic situation. ISO means the same. So the red blood cells are saying the same. And the hypotonic, which is the case of glycine, too much pure water dilutes out the serum sodium, and these red blood cells are going to burst. So that's a hypotonic. And these yellow arrows are showing water. So water tries to equilibrate between the red blood cells and the serum. So in this case, where too much serum sodium, water is being sucked out of the red blood cells. Isotonic, it's even. And hypotonic, too much water is trying to get into the red blood cells to equilibrate with the sodium in the plasma. So this is a case of water intoxication, where large volumes of hypotonic fluids cause all these volume shifts. You get volume overload, hyponatremia, hemolysis of red blood cells, seizures, causes cardiac arrhythmias, and of course death. So too much electrolyte-free fluids will cause water intoxication. Okay, let's go on to more male problems. Your 70-year-old uncle refuses a rectal exam during his routine physical exam. What are they trying to find on his rectal exam that could save his life? A, prostate cancer, B, rectal cancer, or both are correct. And this is a sagittal view showing a rectal exam. And you can see right here, the prostate is very accessible. And this is the thing about prostate cancer, is it's very easy to feel on a rectal exam. On a rectal exam, it will generally be in this posterior lobe, and you can feel that hardness. And it's slow to cause impingement of the urethra as opposed to benign prostatic hypertrophy. So it's important to do a rectal exam on men as they get older. The other thing is, remember rectal tumors, very common, colon cancers, and they're actually easy to feel just with a digital exam. All right, another subject about the bladder. Your bladder is full. You can't get to a bathroom right away. And then you notice the sensation seems to go away. So this is your closed rest area, and you've got to wait to get to the next one. This is because your bladder lining has this great transitional epithelium. So the great thing about the bladder is it stretches readily and allows for storage of urine. So you can wait. Okay, so the disease presentation is a situation where you cannot wait. Interstitial cystitis is called a painful bladder syndrome. So it's this constant feeling that you have to urinate. The cause is really not known, and it's usually a diagnosis of exclusion. If someone comes in with these symptoms, they'll be put on antibiotics to try to hopefully treat a bacterial infection. But even still, if it doesn't treat it, the diagnosis may be that is interstitial cystitis, which is inflammation of this bladder lining. So the bladder can't stretch normally, and it's a feeling of always having to pee. Okay, let's go to another disease presentation. This is in a developing country, a 35-year-old woman that I took care of anesthetically. She came back to the medical facility a month after she had a very challenging cesarean section. There was lots of blood, and they had a hard time during C-section. So she comes back a month later with back pain. Urine is leaking from her vagina. So she's incontinent. And on ultrasound, she's got a large kidney. It's called a hydronephrosis on the ultrasound on one side. So this is because, remember I told you things were very difficult. This is the uterine incision I colored with a white line. They inadvertently cut the ureter on the left side, and they inadvertently, during the suturing, sewed it to the uterus. Now there was a tiny hole that was forming between the ureter and the uterus, so urine was leaking down into the vagina. But it wasn't a very big hole, and so urine was also backing up into that left ureter and developing an overflow and hydronephrosis, a large kidney on the left side, causing a lot of pain. So there it is. It's another depiction. It's called a ureteral fistula after a cesarean section. This is during the surgery. Her ureter is very distended from the pressure of urine trying to come out. And this is a vastly dilated, huge ureter on the left side. So the treatment for this is cutting the insertion site into the bladder and then developing another opening into the bladder. So in doing that, he evoluted some of the internal transitional epithelium, this is the bladder. So forming a new opening to the bladder, and then taking the ureter and placing it in this new site. And then in order to keep that from being avulsed and off too quickly with distension of the bladder and relaxation of the bladder, he did what's called a psoas hitch. So he's put an attachment of the ureter to the bladder, attached to the psoas muscle to keep the bladder close to the side wall and keep it from moving up and down while this insertion of the left ureter healed up. Okay, so that brings back the important point that the ureter can be easily damaged during pelvic surgery, for instance, hysterectomies or cesarean sections. In summary, we went over the gross anatomy, where the kidneys sit retroperitoneal, some of the functions, the endocrine functions, along with acid base, toxic waste, and then men versus women. Why it's really important to make sure that men get evaluated if they've presenting with recurrent urinary tract infections. And then the ureter and the pelvic surgery, that risk. Any questions, please leave comments.